Well, good morning, everyone. Once again, welcome to another live, and hope you're having a great start to your day. We appreciate you guys coming on with us as usual. And we want to say hello to some dear friends. And I wonder if it's Brahim or Mike. It's Mike. You guys. And Brahim number 2. Andrea, Niagara Falls, good morning. And Laurie Lee, Ventura, California. And Kevin from Oshawa. Sandy, good morning. And Carrie, Nebraska. Fran from Orangeville, good morning. Mary, Norwich. Nick from our staff. And Wendy from Markham, good morning. Yolande, bonjour. And Ashley Anna. Marilyn, Kelowna, bright and early. Donna from Park Hill, Marlene, good morning. And Christy, how are you? Linda, I'd never met a Linda. Shirley, Twin Gate, Newfoundland. Diane, Thunder Bay. And Annette, Nouveau Brunswick. Gina, how are you? And Teresa. And Diane from Ottawa. Elaine, Newfoundland. Wanda, Virginia. And Douglas, St. Thomas, Ontario. Deb from Motown. Detroit, Michigan. Judy. And Sherry. Oh, I could sing, Sherry. I could sing. Catherine. Springdale, Newfoundland. Norma from Texas. Elsie. Good morning from Newfoundland. Victoria. And Donna. And Gertie. Hi, Gertie. Burlington. Linda from St. Jude, Quebec. Bonjour. And Judy. Good morning. We appreciate you guys. Agnes and Bonnie. 2 more. Brenda, how are you? And Donna. So 3 Donnas at least. And okay, Sharon and Rita, Wasaga Beach, and Milika, our dear friends. You guys we appreciate you. And Beverly and Arlene. Okay, here we go. Question and answers. Okay, here's lots of good questions, guys. So let's get into it right now as I pull this up. Vitamin D number is high, 478. Yep, that's high. What could it do to your body when it's at a toxic level? Not much. Guys, I teach you this almost every day. Okay? Better to have high vitamin D than low. Look. If you're in a high level, okay, what's going to happen? The worst thing that can happen is it starts forming kidney stones. So, to the kidneys. Has it ever happened? It's so rare, I just don't know what to tell you. For all of the scary things, vitamin D is toxic. No. Okay? And studies have been done on this. 50,000 IUs a day, every day for 6 months would give you toxic vitamin D. I mean, who does that? Now remember, you get vitamin D from the sun, you can never get toxic. I mean, you can get a sunburn, but you're never going to get toxic with too much vitamin D, or even food. Can't eat too much vitamin D. Now, you could possibly supplement and get too much vitamin D. Okay? But when I see, I look at dehydroxy numbers. That's your vitamin D serum numbers, okay, in your blood. When I look at that, and whenever I see high, there's always usually a reason for it, okay? And let me give you a couple. One, you're on medication, okay? And diuretics, estrogen therapy, or even if your estrogen is too high, that can cause high levels of vitamin D. And prescription drugs. But if your number is around 400, okay, that's Canadian number. Cut back. Don't take vitamin D. Just take vitamin D when you can get out in the sun, and stop taking it for about a month. And it's usually a reason for it. Sometimes autoimmune can cause high levels of vitamin D too. But as far as toxicity, nah, don't buy it. Okay, don't buy it. They're trying to make vitamin D the boogeyman. And it's not based on any foundation at all. Vitamin D, the benefits are legion. Okay? The benefits are legion, and I talk about it every day. Thank you so much for the question. And that was Brenda. Joe, for those who are doing the 30-day reset, yep, and planning to stay with the EMC, good idea. When done with the reset, what do you suggest to those that are involved in endurance sports? Who cares? It's the best. Joe, it's the best. You see, think about endurance, okay? You want fuel. You want the right fuel. Okay? Let's say you're going on a long bike ride, or you're running a marathon or whatever, okay? Endurance sports. Long distance swimming okay. What's the best fuel? Carbs? That's how they burn. They burn like paper and twigs on a wood stove. Is paper and twig? Yeah, it's all right to get started. But what's the best? Logs, eggs, meat, and cheese. So you don't need to get away from it. Look, weightlifters or whatever, they can eat carbs. Why can they eat carbs? They got huge bins. But that doesn't make it good for them. That doesn't make it good for them. Look. So endurance sports, I did work with professional athletes for years. And I had to try and convince them that what they had learned about carbohydrates and having carbs before a meal, no, you want to have steak. The old days of, I remember when I was a kid, a pregame meal for the Montreal Canadiens or whatever was my favorite team. It was steak. And then they got away from it in the 80s, and that they started to, pasta and carb loading, they called it. I said, man, you don't want that. Get back to the old days with steak. Okay. Thanks for the question, Joe. Okay, let's get to some more. Jan, can I overdo it with Himalayan salt? Well, the only way you could overdo it, Jan, is if you're not drinking enough water. The only time salt can elevate your blood pressure is in the absence of water. It's called viscosity. The blood thickens up. You need water. Water and salt. Salt and water. Okay? So nobody ever got high blood pressure from salt. They blame salt for what sugar does. So you can't overdo it with Himalayan salt as long as you're drinking water. You should see how much salt I pour on my food. And I take salt in my water every day. But you better be drinking enough water. That's the key. Okay? That's the key, Jan. Okay, Deborah, I have kidney stones. There we go. 2 non-obstructed and 1 stuck in the kidney. What is the best thing to do or supplement to take along with drinking water? The number one thing is get off. Okay. Stones. And if you could get me this, Deborah, and you send it to info@martinclinic.com, okay? Find out what kind of stones you have. 75% of all kidney stones are oxalates. Salad, spinach, okay? Not coffee. I answered that last week, okay? Does coffee have oxalates, Dr. Martin? Must be bad. No, tea has oxalates. For you teetotalers, why would you drink tea when you could drink coffee? One of them is oxalates, but I don't worry about that too much. Okay? But, okay, coming back to your question. Okay, hold on, let me see it. Deborah, if you can, find out what kind of stone you have. Is it oxalates? 75%. You know what 25% is? Uric acid. Are they uric acid stones? You know how you get uric acid? Sugar. Especially high fructose corn syrup. They create stones. Uric acid stones. Okay? So if you can, find out about what kind of stone you have and send it to info@martinclinic.com. Let me know about it. The other one is the best supplement. Well, I like magnesium. Magnesium helps to dissolve stones. So does potassium. How do you get potassium? What's the best source of potassium? Bacon. Bacon's got more potassium than a banana. Twice as much. Why eat bananas when you can eat bacon? Okay? I'm almost considering making bacon vitamin B. The real vitamin B. Okay? Eat bacon. Good for you. And you like it. Who on God's earth doesn't even like bacon? People love bacon. It's good for you. Okay? It's good for you. Potassium. Magnesium. Get magnesium citrate. It helps to chelate those stones out of your body. Okay? Good question. We appreciate it so much, Deborah. And drink lots of water for sure. Mo. My 4-year-old granddaughter has been diagnosed with type 1 diabetes. Okay, poor little thing. That's an autoimmune. She's not making enough insulin. Her pancreas isn't working properly. Okay? Can you reverse it? No. God can. I can't. Okay? You need a miracle, but you can control it. And a young child, I used to see a fair amount of type 1 diabetes. And I reminded them, it's diabetes. It's autoimmune, so you need medication. You need insulin. It's one of the greatest discoveries too is insulin. Okay? Because for type 1 diabetes especially, it saves their lives. You see, medicine, you can't throw out the baby with the bathwater. The pharmaceutical industry even. You can't throw out the baby with the bathwater. Some people need meds. And type 1 diabetics are a classic example. It's an autoimmune disease. But let me say this. Food is everything too. Okay? Now, again, they teach what I don't like with type 1 diabetes. And they teach that it's always controlling that sugar. Go low, you need a chocolate bar, right? And goes high, you need more insulin. Okay? And it's a constant thing. And I'm not saying don't monitor it with type 1 diabetes. Of course you do. But here's what I found over the years with people, type 1, you have an allergy to carbs. And they do so much better with high protein, high eggs, meat, and cheese. They do so much better. They're not cured. They're not cured, but they're better. They're in better control of their blood sugars. Okay? Better in control of blood sugars. Thank you for the question, Mo. Okay? Cecilia, I went for a live blood test yesterday and I was informed that I'm a type A. Who cares? No, I'm not going vegetarian. That's a bunch of nonsense. I have candida parasites, okay, and low in B12. How do you know if you're low in B12? On a live blood. Now look, you can guess, but that's all you're doing, Cecilia. You don't know if you're low in B12. You need to do a blood test. Okay? So what are your blood test numbers on B12? Okay? What are your blood test numbers? I know live blood. I used to teach it. Okay? But I didn't do it necessarily for low B12. Now you might have, had big red blood cells or whatever. And that could be an indication, but I need your numbers, Cecilia. I need your numbers. And you should be between 800 and 1200 for your B12. Okay. So my question is, why is my system not absorbing vitamin B12? I don't know that for certainty. You tell me what your B12 numbers are. Get your B12 numbers to me and let me know. And then I'll answer your question. Get rid of those candida and parasites. Okay? Get rid of that stuff. Cecilia, I'm wearing this just for you. Don't feed the bears. I even got my Don't Feed the Bears t-shirt on. Okay? Don't feed the bears. Okay. Sue, what supplements are suggested for prevention of macular degeneration and what would benefit AFib? Two different questions. Macular degeneration, circulation, circulation, circulation. Eyeballs, circulation. This is why I always talk about diabetes and insulin, because sugar is so toxic, it will cause circulation problems. And one of the first places it starts is in the eyes. It's all circulation, destructive blood vessels. Your eyes are full of blood vessels and they get damaged by sugar. So one, lay off the stinking sugar, okay? And two, macular degeneration. One of the best things you can do for your blood supply, take two things. Take two things and watch the difference. Navitol, because it opens up your blood vessels. Nitric oxide, it's a powerful antioxidant to protect your blood vessels. Opens the blood vessels, more blood. Two, it protects your blood vessels. Rust proofs them. Antioxidant. Powerful. The best in the world. Okay? Two, high DHA oil. Why? And I've proven it to hundreds and hundreds, if not thousands of people. You want to improve your eyeballs? DHA oil. Yeah, DHA for your brain. Yeah, DHA for your heart. It's oil, man. It lubricates. You need an oil change. Your car does, and you do too. High DHA oil. It's the best of the best of the best to lubricate the blood vessels. You want oil, my friend. Your eyes need it. Your lens needs it. Everything in the eyeball needs that high DHA. I've proven it again and again and again. You combine that with Navitol and there's nothing better, in my opinion, for macular degeneration. Now, you asked me about AFib. I talked about this the other day. Okay? I talked about the circuitry in the heart. One of the biggest things for AFib is CoQ10, ubiquinol. You got more mitochondria, battery packs in your heart and brain than anywhere else. A multitude. 5,000 batteries and battery packs within your heart muscle. And you need that for the circuitry, for the synapses, for electricity. And AFib, CoQ10. And make sure it's ubiquinol, not ubiquinone. And eat steak, okay? And the other thing is magnesium. People that have AFib usually are low in magnesium. So you have two choices when it comes to magnesium, okay? I always like magnesium citrate, and it's the one that's the most bioavailable in your body is magnesium citrate. We put out a magnesium biglycinate. Why do we do that? Because the only side effect of magnesium citrate is it can loosen up the stools, okay? And some people that bothers them. So a magnesium biglycinate is fantastic too, okay? I love magnesium, guys. Okay, it's involved in almost everything in your body. You need it. Okay, thank you for the question. And that was Sue. Judy, what are your thoughts on taking cloves for health benefits? Well, I'll tell you what I like better, Judy. Okay, cloves are good. Can I tell you what's better? Because they've got a lot of good. They got antioxidant properties. They're antifungal. They're antiparasitic, antibacterial. But can I tell you what's better? So that's good. Cloves are good. You know me. Good, better, best. What's the best? Oil of oregano. Every day, I tell people, take oil of oregano. It's God's antibiotic. It's God's antifungal. It's God's anti-parasitic. It is so good for you. And it doesn't kill your good guys. Only kills the bad. It's so good for you. Okay? So, yeah, cloves are all right. Okay, Patricia, can high estrogen cause joint pain? Well, look, I guess I'm trying to think of how. It wouldn't be the first thing I look at, okay? High estrogen causing joint pain. Okay? Now, that's a big problem in our society today is high estrogen. It's a growth hormone. So I'm more concerned high estrogen for cancer, breast cancer, prostate cancer, okay? Those are high estrogen cancers. High estrogen can create inflammation in the body, so possibly, indirectly, could be a factor in joint pain. But it's not the primary thing I think of, okay? How do you get your estrogen down? Patricia, how do you get your estrogen down? Okay? Flax seeds. Okay? That's why I talk about flax seeds all the time. Flax seeds have lignans, and lignans block estrogen, extra estrogen. You need estrogen. You're a woman. And you never have to worry about estrogen. You don't. Not about having too little. Not in this day and age. Every stinking chemical that man has created mimics estrogen. Plastics and air fresheners and antibacterial soaps. Oh, I hate those things with a passion. Don't put that stinking stuff on your skin. Don't put sunscreen on your skin. You're elevating your estrogen. Yikes. Okay. Thank you very much for the question. It's so good questions. Patricia, does Dr. Martin know about dish decrease? Dish. Well, I know about dishes. Okay. Look, yeah, we had to learn about it in school, okay? What do they call that? Diffuse idiopathic, diffuse idiopathic, let me look at the S, skeletal, okay? Hyperostosis. It's usually you're forming more bone. Okay? So you're asking about the decrease, Jocelyn. Do you know about the dish decrease? You know what, Joss? I need you to get a lot more specific with me. Okay? When I used to have my radio show, okay, people would phone in and I said, spell it out, man. Like, I don't know. What are you asking me? Okay? So why do you want to, first of all, Josh, here's what I want to know. Then you email info@martinclinic.com. Okay? I want you to tell me what you're asking because I do know what dish is. Not dishes, D-I-S-H. I know what it is. The decrease in dish. I don't know what you're asking me. Be more specific if you can, okay? Because then I'll give you a better answer. Right now, I'm just guessing. Okay? I'm just guessing. Okay. Okay, Josh, do that for me. And I appreciate the questions. I do, okay? Sometimes I just got to get you to be a little bit more specific for me. Suzanne, my question is, when the liver produces bile, stop right there. You're right. Okay, Suzanne? Where does bile come from? Your liver. Okay? And the gallbladder acts as a reservoir. Oh, Suzanne, you're so smart. Yep. It's a little pouch where bile sits. Okay? What happens to that bile when you no longer have a gallbladder, and can your liver still function properly without it? Oh, for sure. 100%. Now listen, when you don't have a gallbladder, you got a weakness. God gave you a gallbladder. So obviously it's needed, right? But you can live without it. Because it's not the producer of bile, it's the reservoir for bile. Your liver is the one that produces it. If you don't have it, you might not be able to eat as much fat. I think if you ask Kevin, because I think it's Kevin, would tell you he don't have a gallbladder, and he has to be more careful, I think, with fatty meats and things like that. But one thing I found over the years, okay, is that if you're doing EMC and you don't have a gallbladder, a lot of women don't have gallbladders. You would be shocked, Suzanne, how many people don't have gallbladders. Women that use it or lose it. If you don't use your gallbladder, and if it drives me mental. I mean it. When I get on the internet or when I hear former patients or whatever, and they tell me, if I don't have a gallbladder, I better not be eating eggs, meat, and cheese. Why? And a lot of doctors, because they don't know nothing, honey, about nutrition, they said, well, you had gallbladder trouble because you were eating too much fat. No, you weren't eating enough fat. It's just the opposite. Women that love salad and chicken lose their gallbladders. A lot of them. And there's another reason, okay? And I've taught you this in the past. I'll do it again. Estrogen, okay? And progesterone. When you have a baby, okay, you leave all your progesterone in the placenta. All the progesterone is gone. Now your body starts producing it. But progesterone is needed for smooth muscle. Thus, women have trouble with gallbladders when they lose all their progesterone. And that's why a lot of times after a baby, you have a gallbladder attack. You lost all your progesterone. And bladder troubles. The bladder descends. Not enough progesterone. Okay? The pro-baby hormone. It can become a hormone if you don't have enough of it. Okay? And that's why I always talk about the balance between estrogen and progesterone. Okay? So, Let me just make sure I answered that question to its fullest. Okay. Yeah, your liver can function. And just keep working at it. Eat eggs, meat, and cheese. And you might have to start a little bit more slowly, that your body gets used to producing the bile and helping you to become more accustomed to eating fat. Okay, thanks, Suzanne. I thought when you dreamt it wasn't a good sleep. Well, you thought wrong, Giselle. Okay? It's good to dream. It usually means you're going into the 5 stages of sleep. You got 5 stages, and rapid eye movement sleep, REM. The REM sleep, often there's dreams in there, and dreaming is all right, not nightmares. Okay. No, I can't remember my dreams, but pretty well. But I think I dream. When I get into a good sleep, I'm dreaming. I'm dreaming. Oh, we're not supposed to sing. Okay. Giselle. Dream. Who was that? The Beverly? No. Who sang like that? I'm going to think of their name. It was the brothers. Dream, dream, dream. Okay, I shouldn't be singing. They tell me not to. Angela, would chelation therapy help cholesterol? No. It's not made for cholesterol. Well, look. It's made to remove plaque. Okay. What was discovered? EDTA. Okay? After World War II, a lot of soldiers had lead poisoning, handling the bullets and the ammunition. They got lead poisoning. They developed a vinegar-like substance called EDTA. Okay? And they found out later, not only did it chelate means biting off. It bit off the heavy metals out of the body. But they also found it good for removing plaque. So it's Angela, you're talking cholesterol, I'm talking plaque. Okay? I'm talking plaque from your arteries. EDTA. I like it. Okay? I like it. And if you, Angela, would send me info at Martin Clinic and send me your email, I'll tell you how you can chelate heavy metals or plaque. Okay? Thanks for the question. EDTA. Okay, let me see. Where are we here? That was Angela. Brenda. What triggers PMR? Okay, polymyalgia. Okay, polymyalgia rheumatica. Poly means lots of different places. When you get polymyalgia rheumatica, it's because you got severe pain in your joints, shoulders. I had patients come in and they couldn't even lift their arms. Okay? They were so sore, couldn't tie up their shirt. And they often needed help to get dressed. And it comes out of nowhere. It's an autoimmune thing, but caused by usually viral. Okay? Viral. And I always said this about PMR, okay? It was a perfect storm. It's just like when someone gets shingles. Stress, decreased immune system, okay? It's a perfect storm. And the virus gets activated in shingles, and polymyalgia rheumatica, it's usually viral, gives you severe pain. and you can be crippled up and it's no fun under the sun, but it's usually a perfect storm. I saw it many times in my days of practice. Okay. And I would do a detox with the patient. I would have them on probiotics. I had them on Navitol. I had them on to kill the virus. I would have them on oil of oregano. I'd have them on good levels of vitamin D, sometimes even vitamin A, steak. Vitamin A, real important for the immune system. And what else did I use? Anyway, okay. Thanks for the question. It's a very good question. Appreciate it. Okay. Let's see. Might even be able to get done today. I don't know. Maybe yes, maybe no. Let me see. Yeah, maybe. Okay. That was Brenda and Amrit. What is the supplement for Parkinson's and back pain, knee pain? I can't. Well, look, once our inflammation formula is back on, and it's coming soon to a theater near you. Oh, in the meantime, I love curcumin. Curcumin is so good. You should see the studies coming out on curcumin. Unreal. Very powerful anti-inflammatory, very powerful for the liver. And, I love curcumin. I take it every day. And it's good for your brain. It's good for your heart. It's a powerful antioxidant. And I really like it with Parkinson's and probiotics too. Big time. Okay? And what I would do, Amrit, would you please check, because you probably have fungal. Parkinson's brings heavy metal to the brain. And I mean, yeast does. Get rid of that yeast. Don't feed the bears. Okay? Yeast, that's what I mean by that. Don't feed them. They only live on sugar. No more sugar. Kathy, I would like it explained why you talk salt on the reset. I understand that Dr. Martin wants us to have a good salt. How much went off and on the Well, look, Kathy, I want you to have salt every day. Your body is made up. It's salt. You need it. Now, you need good salt. You need salt with lots of trace minerals in it. Okay, a good Himalayan salt has 84 trace minerals in it. It's so good for you. You're meant, in the Bible, salt was used as a preservative. And salt will preserve your body. Okay, it's so good. People always, they poo-pooed salt because they thought it caused high blood pressure. I answered that earlier today. No. Bad salt, okay. In the absence of water. But it's good old Himalayan, Celtic, and trace minerals, man. They're so good. And if you go on our private Facebook group there, people will answer those questions for you because they found salts that they really like. Okay, I use pink Himalayan. Okay. Thanks, Kath. Priscilla, can you detangle this confusing information for me that says to avoid red meat and coffee if you have elevated red blood cells? Priscilla, I'm having a heart attack. Oh, avoid red meat and coffee. Oh, Priscilla, first of all, can I be pleasant? That's so stupid. It's not you. I like you asking me the question, but you just understand. I have to get over my high blood pressure when I hear that stuff. I have to get over my migraine when I hear nonsense. When I hear nonsense, I can't help it. I get high blood pressure. I get a migraine. Red blood cells. If you have too many red blood cells, you know why? Too many is not good either. Okay? But it has nothing to do with eggs, meat, and cheese. It has nothing to do with red meat and coffee. It's the opposite. When people have too many, and when they have too many, it's not, they actually have less oxygen. Red blood cells carry your hemoglobin. And when you have too many, they're not carrying it properly. You've got too many, but they're not doing their job. Meat is the best thing. Red meat is the best thing. B12, which is really important. Heme iron, which is the iron that your body absorbs the best. And look, if you have too many, it's not because you have too many because you got too much oxygen. It's the opposite. You got too many, but they're not doing their job. So it has nothing to do with red meat. And what is coffee? Why did they tell you that coffee? What's coffee? They're telling you to come off vitamin C. Why? It's the opposite. It's the opposite. It gives me a headache. I'm sorry, Priscilla. I'm glad you gave me a headache this morning. No, we appreciate you, Priscilla. Okay, I love those questions. I do. It's just that, ooh. Okay, Rita. And now Rita's going to give me a migraine too. Okay? I think you guys do it on purpose. Here's what Rita says. Can Dr. Martin comment regarding plant-based diet to prevent illness and unburden the Canadian healthcare system? It's propaganda, Rita. It's the farthest thing from the truth. Look, you like plants? Good for you. You like fruits and vegetables? Good for you. They're not meant to live on. They're not. And Rita, you know that. You're just trying to get my goat, aren't you? You're just trying to poke the bear, aren't you? Well, you did. Rita, it's the opposite. To unburden the healthcare. Okay, let me just say one thing. I'll say it as fast as I can. What is the biggest problem in our society today in healthcare? Elevated insulin, insulin resistance, metabolic syndrome. 93% of the population have trouble with that. It is the root of heart disease, cancer, Alzheimer's, and diabetes and autoimmune, and a poor immune system. I mean, guys, I know it sounds so simple, but it's the truth. So when the world says, okay, that's our big problem, let's eat plants to solve it. Nah, that won't solve it. You got to eat eggs, meat, and cheese. That'll solve it. That'll get your insulin down. You can have some plants too, but you're not made to live on plants. They don't have the vitamin profile nor the amino acid profile that your body needs. They don't. You were meant to eat meat. Rita, I know you just wanted to poke the bear this morning. And I love you for it. Ooh, I get so, ooh. Gillian, I have severe bone on bone. Okay, no fun. What about hyaluronic acid injections? Look, it works in about, and it works temporarily, okay? Like they put that your joints are made up of hyaluronic acid. Okay? We put hyaluronic acid, guys, in our Rivera because it's really good for your skin. Okay? And I love hyaluronic acid. I do. Your body makes it. It's in your joints. And when your joints dry up, you don't have enough hyaluronic acid. So the problem with those injections, they work about 40% of the time in my experience. I'm not against them. Some people found really, really good relief, but most, not. It wasn't dramatic. I would work on the inside out. That's what I always did. Look, if you're bone on bone, it's not easy, but you want to take away everything that inflames. And Gillian, I love our inflammation formula. I love the reset. A lot of people with joints that were in terrible shape found it got better. Sugar, what sugar does is incredible to joints, okay? Because it causes glycated joints. Caramelization of the joint. And when you cut out your sugars, what a difference that makes. And lubricate, Gillian. That's why I love the high DHA oil better than any other. Okay, thank you for the question. I got a couple of more and we're out of here. Betty, for the 5 Tibetan, I'm saying it wrong. Rights. What do you think of them? What are they? 5 Tibetan. Okay? What are they? I don't even know them. Betty, what are they? And I'll tell you if they're good for you or not. What are those Tibetan, rights? I don't know what you're talking about. Send me an email. info@martinclinic.com. I don't know what seriously, I guess I could Google it. Okay? Because I don't want to give you a stupid answer when I don't even know what it is. Okay? Lucretia. What to take without the inflammation formula? Well, I'll tell you the one that I take. I like the combination of Navitol and turmeric, but curcumin, the actual extract from turmeric. That's what I use, Lucretia. Okay? And I find it to be good. Okay, last question, Pauline. There's so much being said today about blood cleansing, or cleansing your blood vessels. Well, we just talked about it, EDTA, okay? And it's a vinegar-like substance. And do these products really work? Well, the best thing to clean your blood vessels is vitamin K2. Okay? Because it takes calcium and puts it where it belongs, in your bones and your teeth. Okay? Because a lot of times calcium, we talked about this yesterday. Why would you bring sand to the beach? You got a lot of calcium. You don't need calcium. Eat your calcium. And when you eat calcium from the animal kingdom, it's always surrounded by vitamin K2. Oh, I wonder if God knows best. Because when you eat plants for calcium, they don't have K2 with them. So that calcium goes to where? In your blood vessels. Doesn't get to your bones. Why would you bring sand to the beach? You don't need calcium. You need vitamin K2 when you eat your calcium. Okay. Did I answer your question? What was the question? Oh, blood cleansing. Yeah, I think it's not so much cleansing your blood, although vitamin K2 does that. It's more keeping your blood vessels lubricated and protected. That's why I like Navitol. And it opens your blood vessels. Nitric oxide. Okay? Helps your blood flow. Thanks for that question, Pauline. Okay? We appreciate it. Okay, guys. I got to them all. Betty, 5 Tibetan rights. I never heard of it. Honest to God, I've been on the planet for 72 years. It's the first time I ever heard of that. What is it? Okay. We love you. We'll talk to you soon.